Dr. Osterberg, I want to talk about how chiropractors apparently can help the immune system, simply because blood, nerves, cells are flowing. I don't know the specific of it. I'm sure you can tell us. But anyway, for instance, there is not just a story. A story is a story, but I like stories. But there seems to be evidence, a complete statistically proven fact that about, was it in 1819 or 1909 or whenever, there was the big influenza season out there, and literally millions of people died across the planet. And it's a tremendous, like, I don't know the number now, but the statistic is like something like 80-90% difference in people who at the time received adjustment. Now, at the time, there was no real, the chiropractic profession didn't exist. Dr. Palmer, who founded it, wasn't yet around, or at least wasn't yet writing his book and doing it. But nevertheless, the adjustment has existed before. And people who got that, hey, that's huge. I mean, huge, like that 80-90% less death ratio. They didn't die. I mean, never mind getting this thing. They didn't die when there was. Is there any? Do you know about the story I'm talking about? It? Can you shed more light on it? And because this is big, in my humble opinion, because people are running around losing work days and just like are not feeling good because their immune system is weak, they're sick, they're tired, they're running around worried about the swine flu, the bird flu, they name it, and we keep saying that people say it that it is only around the corner till we do get another pandemic, a big one. I mean, something we haven't seen for a long time. Wouldn't it be wise to have your immune system good, and how does chiropractic help there? How did it help some 100 years ago when that happened?
That's a great question. Let's talk about that a little bit. That was in 1918, and it wasn't chiropractors providing the treatment. It was osteopathic doctors. It was the current DOs, who we know.
I knew that. I just didn't know how to pronounce osteopathic, so I never used the word.
It was osteopathic doctors, and it's true. They did some form of study back in 1918. I haven't read it, but I've heard a lot about it. And they were looking at people that were getting the current medical care at that time, and I don't even know what drugs those were, because my goodness, penicillin wasn't even invented back then. I don't know what sort of drugs they were giving. But they're looking at people who are getting normal medical care versus people who are getting normal medical care as well as osteopathic manipulation. And the death rate was much, much lower in the people who were getting some form of spinal manipulation as well. So it was an interesting report about that event. There must be some kind of connection to that. When you talk about chiropractic care and spinal manipulation and the immune system, I've seen a few other reports. There was some research that was done with people who'd been infected with the HIV virus, and they were measuring T cell counts, and they showed that there was an increase in T cells after there was spinal manipulation. I have to be completely honest, I do not understand the mechanism. I don't know why that happens. I don't know how consistent it is, and I haven't seen any follow-up research to say people who get adjusted or people who see a chiropractor do not get sick as often. My practice is focused on the treatment of back and neck pain. We also treat headaches and other soft tissue injuries, and primarily our focus is being evidence-based. We promote what the research has proven, and the research has not proven that chiropractic or spinal manipulation will increase your resistance to disease. However, there does seem to be some indication from personal experience over the last 80 years. I don't refute that there's some kind of connection. There's obviously something going on between the nervous system and the immune system. I mean, even last year in Men's Health, I don't know what this was founded on, but they had tips on how to avoid getting the flu, and they said that seeing a chiropractor regularly had almost an equal effect to getting the flu shot for preventing the flu. Again, I don't know the quality of the research behind that, but there does seem to be some kind of a connection. People ask us about the health benefits of chiropractic all the time. You know, can we treat asthma? Can we treat diabetes? Can we treat these other conditions? Occasionally, patients get better when you treat the spine. However, we don't specialize in treating the immune system or preventing the flu. If we treat somebody for back pain and neck pain and other conditions improve, that's wonderful. That's fantastic. But that's certainly not our main focus in our practice.
Well, it looks to me like you are just a tad too modest here, too conservative, but that's probably good for your patients because you're not hyping them up and telling them that all of a sudden they'll become godly or something like that. But the fact is, it does make, of course, number one, the studies apparently, what happened in 1918, they are apparently true studies. Now, mind you, the medical, as you pointed out, the medicines have changed also. So it might not be such a drastic difference anymore today. But at the same token, as I don't know was it Hippocrates or was it Edison or was it somebody who said all foods, all medicines are foods, all foods are medicine, and yes, the body heals themselves. And I mean, the fact is, if the nerves are flowing, if the muscles are not tense, all that stuff is happening, it just makes sense that the body is more resistant. That's why, exercise, I mean, no matter what, exercise probably does a little bit what you chiropractors do. And, it just makes sense, but I do understand that that's not what you're there for, that's not what you totally treat, and you look at it as a beautiful side effect. So again, if a person gets lots of flus and is easy, susceptible to that, a couple visits to the chiropractor, they probably won't hurt him, right?
It certainly won't hurt him. However, again, I'll reiterate, there's no scientific evidence that it's going to prevent those diseases.
Okay. Well, here you got it from Dr. Osterberg. Dr. Osterberg, bye-bye.
Thank you very much.